You're buckled into a narrow seat. The cabin hum presses in around you. The overhead light feels too bright, and your breath comes faster than usual. Behind you, someone is laughing. The PA clicks softly, and the metallic taste at the back of your throat makes your stomach roll. You reach for the armrest and feel sweat on your palms. You're not sure if this is anxiety, motion sickness, low blood sugar, or something more serious. The most important thing right now is getting clear, practical help without panicking. Start by staying still and breathing slowly.
If your flight happens to be canceled or delayed, Compensair will help you get compensation for the inconvenience and get your money back without wasting time on red tape. Get a refund for your canceled flight right.
If you can, bend your knees, lower your chin, and take measured breaths in through the nose and out through the mouth. Open the air vent above you a notch. That blast of cool air often helps nausea and lightheadedness. If you have a small bottle of water or a ginger candy in your bag, sip or suck gently. These calm immediate symptoms while you get help. How to get help on a plane. First, use the call button. It's the small button in the armrest or above your seat marked with a little person icon or a light. Press it once and wait. The light above your seat will turn on and a flight attendant will come when they can. If you can't reach the button, catch the eye of a flight attendant walking by, or politely clap once to get attention. Don't shout or panic call. A single firm press or a hand raised is enough. If the situation is urgent, severe chest pain, uncontrolled bleeding, trouble breathing, fainting, press the call button immediately and say medical once the crew arrives. Before you fly, prepare. Pack any regular medication in your carry-on, including a small zip bag with motion sickness tablets, antacids, a glucose gel if you're diabetic, and a printed list of prescription drugs and allergies. Choose an aisle seat if you think you might need quick access to the bathroom or crew. If you have a known medical condition, notify the airline ahead of time. There are short forms to request oxygen, stretcher, or wheelchair assistance, and your airline's customer service can annotate your reservation with a medical code. At check-in or the gate, say plainly to the agent if you have a condition the crew should know about. They can flag your boarding pass.
If you feel a little unwell before boarding, do not board until you feel stable. That prevents an escalation in flight that could lead to a diversion. A calm, simple notification to staff before takeoff is much easier than dealing with an emergency overhead. Why the call button rule exists. Think of the flight attendant as the cabin's first responder and the airplane like a ship at sea. On a ship, you call the crew, not start your own emergency procedure. The crew knows the layout, the equipment, and the procedures, plus how to communicate with the bridge or cockpit. Similarly, flight attendants triage problems, have access to a medical kit, can summon a doctor on the plane, and can radio the pilots if a diversion or priority landing is needed. The single-button system keeps calls quick and orderly, so crew can prioritize multiple needs. That's why you press once and wait. Describe your symptoms clearly. A calm, short script helps. Say your name, your seat number, and your key symptoms. For example, I'm Sarah, seat 14A. I'm dizzy, sweating, and can't catch my breath. If you have diabetes or heart disease, say that immediately. If you swallowed something allergic, say allergic reaction. If you can, hand the attendant your medication list or show a photo on your phone of your prescriptions. What the crew can and can't do. Flight attendants are trained in first aid and CPR, and they have automated external defibrillators, AEDs, and emergency medical kits.
They can assist with oxygen, sit you up, give oral glucose for low blood sugar, or hand you a sick bag. They can also request a ground-based medical consult via radio if needed. They are not doctors. They cannot prescribe medication or perform definitive medical treatment. If a situation looks life-threatening, the captain may decide to divert the flight to the nearest suitable airport. This keeps you safe, but can add hours and cost to everyone's trip. Concrete risk and cost. A minor episode treated in flight is often free and quick. If the captain diverts, expect a delay of at least 1.3 hours for the aircraft to land, disembark, and reroute. A diversion can also cost the airline tens of thousands of dollars, and that cost can sometimes be billed to passengers, in very rare cases if the emergency was caused by negligence.
More importantly for you, a diversion can mean missed connections, extra hotel or transport costs, and an ambulance ride. The effect on your travel plans can range from negligible to several $100s in rearranged tickets and hotels. The real worst case, refusing obvious care for severe symptoms, risks serious harm and permanent consequences. Never delay calling for help because of embarrassment. Cheapest, safest, practical solution? Press the button, stay put, and speak clearly. If you have medication, show it. Ask for water, a damp cloth, and a cool compress if you feel faint. If nausea is the problem, ask for ginger ale or a path to the restroom. If anxiety is the issue, tell the attendant that you're anxious and ask for a quiet corner or an empty row to lie down. For diabetics, check blood sugar immediately and treat low sugar fast with juice or glucose tablets. If a fellow passenger offers help and you need it, accept. If you prefer privacy, ask politely for a blanket or to be moved to a less busy area of the cabin. A specific trick that helps first-time flyers: memorize a 2-line script. I'm name, seat, row. I need help. I feel symptom. That short, factual line gets attention fast and removes the small talk that can otherwise delay urgent action. Hidden upsell and misleading claim to watch for. Some travel insurance pages and third-party booking sites will show a medical assistance phone number that routes you to a private medical concierge who charges a fee for a doctor's call. Airlines do not require you to use paid third-party medical help while on board. Also, beware the gate or ground staff who suggest an upgraded seat or paid lounge access as a way to rest before deciding if you're medically fit to fly. That's an upsell, not a medical fix. If the crew suggests a diversion, it's because of safety, not to sell services. You can refuse non-essential paid services politely. Say, "No thanks, I need medical attention only." If an attendant asks about your insurance or wants to bill you for a doctor's call, ask for the name and badge of the person making that request and request that they call the captain or the airline's operations desk first. On most flights, in-flight treatment and the cruise time are part of the airline's duty of care. Out-of-pocket bills usually arise later for ground ambulance or hospital charges after landing, not from the flight attendant's basic help. Practical packing and pre-flight checklist to reduce risk. Carry a small medical card listing conditions, allergies, emergency contacts, and medications. Keep medicines in a labeled carry-on pocket and bring a printed doctor's note for unusual items like syringes. Bring plain water, ginger candy, and a small snack to prevent low blood sugar. Choose an aisle seat if mobility or quick bathroom access will help you feel safer. If your symptoms look serious, severe chest pain, sudden weakness on one side, difficulty breathing, severe bleeding, or loss of consciousness, tell the crew the word medical emergency immediately. That triggers faster triage, more crew attention,
and a higher chance the captain will consider diversion. Many useful links can be found in the description. A few etiquette notes. Be honest about symptoms. Exaggeration can waste time, and underplaying can hurt you.
If you're pregnant and feel unwell, say so. Certain risks change the crew's approach. If you have a contagious illness with fever, tell the crew so they can limit exposure and notify medics on landing if necessary. Mid-video quick tip. If you're nervous, practice pressing the call button once and saying the 2-line script quietly. You'll feel more in control. If this is helpful, please tap like and subscribe for more practical travel tips. After the crew helps, follow their instructions. If they recommend a doctor's visit on landing, accept it. Keep receipts for any taxi, hotel, or medical expenses if the flight diverts. Your travel insurance may reimburse those costs. If the crew refuses your request for a particular medical step that you believe is necessary, ask to speak with the purser or the captain. They have the final say on safety decisions. Final reassurance, and one last practical point. Most in-flight illnesses are mild: dehydration, motion sickness, anxiety, or low blood sugar, and are resolved with water, rest, and a few minutes of attention. The flight attendants are trained to help you, and the call button exists to make that help simple. Press the button, be clear, accept basic care, and only escalate if symptoms are severe. If this video eased your worry even a little, remember to subscribe and like. It helps others find the same calm instructions before they fly. Thanks for watching, and safe travels.